Whooping cough pertussis, an acute infectious disease of the respiratory tract characterized by paroxysmal cough ending in a whoop upon inhalation. Causative organism, Bordetella pertussis. Incubation, period 7 to 10 days. Signs and symptoms. It consists of 3 stages. Catarrhal stage. In this stage, the child suffers from cold, cough, itching, redness and inflammation of eyes, sneezing, rhinorrhea, congestion of throat and nasal mucosa. Dry cough, cyanosis and shortness of breath are features of this stage. Patient looks toxic with rapid pulse. 2. Paroxysmal stage. In this stage, the disease progresses and the child has severe attacks of dry cough. He has many attacks of cough at a time. These attacks of cough are followed by a specific voice of whoop or vomiting. Most children die in this paroxysmal stage of cough. 3. Convalescence, recovery stage. In this stage, the symptoms of child improve. Cough becomes decreased, general condition of patent becomes good, and at the last patient recovers. Complications. Patient may develop pneumonia. Intracranial bleeding may occur. Intraocular bleeding may occur. Convulsions may occur due to hypoxia. Asphyxia is one of very critical complication, usually made on clinical features. Throat swab culture is useful. X-ray chest may be done. Complete blood count with ESR, urine, RE. Preventions. DPT vaccine must be done to all children. Erythromycin should be used to those children who are in close contact with the patient. Hyperimmune globulin can offer temporary passive protection to the non-immunized children. Treatment. Good nutrition is advised. Cough suppressants like Sanco's DM, Cozome, antibiotics like azithromycin, erythromycin, etc.